To answer number two, I know there's going to be tons of situations where they're going to not have a lot of time to prep a child, or a resident might just be like, this is going to be a waste of time. There's no need. But I really want to say that, like, as a soon to be child life specialist, preparation is so important. And it just like I would advocate for my role as a child life specialist and the rights of that child, that they deserve the right to have preparation, so that way they know what they're about to expect no matter what, because that's how a lot of like misleading information happens, or more frightened and scared children go into operations. I just would just say that using preparation is very crucial, and it helps reduce anxiety, and it makes the child feel more comfortable in those medical procedures, and so that they would be more cooperative throughout the whole thing. And I know in past research articles that I've read that children who are more prepared, they have less distress, and they have more coping behaviors, and are it benefits the whole preparation process. Um, and it also helps just everything go smoother with not just that child, but like the medical staff working with that child, because that child is more cooperative, so, and they're more prepared, so they know each step of what's going to happen next. Um, I also feel like us as child life specialists have like a responsibility to speak for that child's rights, and be able to like support them and their family no matter what time or where or when um, that child may undergo a procedure or about to, that we need to advocate that they need preparation no matter what, and because it just helps everyone, and especially that child's emotional well-being the whole time that they're there. And we, as child specialists, have the tools to help them. We have interventions that we can provide with play, um, more therapeutic and medical play interventions as well, that can really just help de-stress that child and their family. I think using those preparation techniques that we have learned, we can improve the overall experience for that child. So that way, next time, if they have to come back to the hospital, they feel more prepared and are less scared or frightened towards the medical staff. And I also think as child life specialists, we need to advocate for that child and their family, so that way their rights are respected and that they deserve that kind of preparation. And I think just like using those evidence-based practices, it just really reduces anxiety a lot and helps children understand what to expect. And then also making them they are more cooperative. So it makes things go easier and quicker, and less bills for the family and the child, especially if they don't have to go on anesthesia. I think also it has better outcomes for those children, and those children have more of a faster recovery and fewer complications, since they're going to be more cooperative and more helpful during that time. And I think just being an advocate for those children and those families, that even though it might seem as a rush and we don't have enough time, there is always enough time to even just add a small little bit of preparation into there. It doesn't have to be a whole book or anything, or a whole intervention, but it could be at least 3 minutes of just explaining the steps on explaining what they need to do.